So we're returning to speak about a lack of health and caring in the United States as part of Chapter 8 of Healing America's Narratives. And we want to take a closer look at addiction, which is rampant in the U.S., related in many ways to anxiety, depression, and suicide. We have an addiction to a variety of both legal and illegal substances, including but not limited to alcohol, nicotine, heroin, cocaine, opioids, and methamphetamine. According to the Centers for Disease Control, this is prior to the COVID-19 pandemic, overdose deaths, not people just being treated for addiction, but overdose deaths in the United States were approximately 64,000 in 2016, 71,000 in 2017, 68,000 in 2018, 72,000 in 2019, and 93,000 in 2020. And again, about 9 months or so of 2020 would include the psychological and mental impacts of the COVID pandemic and a lot of fear that arose around that. More than 900,000 Americans died from a drug overdose between 1999 and 2019, right? Of those, almost 247,000, so over not quite a quarter of a million, died from prescription opioids. And as we now know, that much killing from prescription opioids required the cooperation and/or apathy among patients, victims, pharmacies, healthcare professionals, and pharmaceutical companies. So I'm not going to spend a lot of time speaking about this, but one example of the involuntary conspiracy, maybe, I don't know if it was involuntary or not, but on October 21st, 2020, the U.S. Department of Justice reached a federal criminal and civil settlement with Purdue Pharma and members of the Sackler family. The Sackler family, a group of medical doctors who had founded this pharmaceutical company. The settlement was for more than $8 billion. It called for the dissolution of the company and a repurposing of its assets. In 2007, Purdue Pharma and 3 of its executives had pled guilty to criminal charges for minimizing the risk of OxyContin addiction. That was one of their drugs. By September 2019, the company was facing 2,900 lawsuits and filed for bankruptcy. There's a lot more to that story, and I'm not going to unpack the whole thing here. But again, the complicity of people with whom we entrust our health, medical doctors, pharmaceutical companies, and by default, the federal government, and in fairness, state governments as well, who weren't paying attention to what was going on or didn't pay enough attention to what was going on with these opioid addictions, led to a major tragedy in the United States. So that's one example, just using addiction to speak to the lack of health and caring in this country. And we didn't quite ask yet, why is it that addiction might be so popular in the United States? And we'll touch on that a bit in the next episode. Thanks for tuning in.